Well, I'm P Yadava. I'm the Chief Cardiac Surgeon and the Chief Executive Officer of the National Heart Institute in New Delhi. Certainly, bypass can be done with renal artery stenosis if the coronary anatomy is not critical, things like left main or a proximal LAD, then we can either do a renal artery stenting before the bypass surgery and restore the blood supply. But if coronary artery anatomy is critical, or if the patient is getting unstable angina, in that case one should proceed with CABG first, taking certain precautions of number one, trying and doing a beating heart surgery that would maintain better flow and a pulsatile flow to the kidneys. Number two, using technologies like ultrafiltration or artificial kidney on cardiopulmonary bypass if you are using a CPB. Number three, maintaining a higher perfusion pressure if you are using a CPB, and certain other precautions like not using nephrotoxic drugs. Also, if these patients ever go into renal failure, then there should be a short threshold or a lesser threshold for early institution of renal replacement therapy and for dialysis so that they recover fast.